So there is Tourette syndrome, and then there is Tourette families. So in Tourette syndrome, we need to have the criteria fulfilled, that they have to have a mix of motor and vocal tics, at least one of each. They have to have onset before age 18 and duration for more than a year. So he doesn't have any tics right now, as far as I can tell, but maybe in a longer video, there were something that maybe tics. However, what you're pointing out, Wazir, is the Tourette families. The Tourette families have this combination of three conditions that run in the family. One is the Tourette syndrome, the tics. The other is ADHD, and the third one is OCD, Obsessive Compulsive Disorder. And my mentor, who actually belongs to a Tourette family, and he has Tourette syndrome, he tells me that the distribution is about a third. So 30%, 33% of the family members have tics, 33% have ADHD, and 33% have OCD. However, the problem is that more than one can happen in the same person. So same person may have tics and ADHD, or same person may have ADHD and OCD. And he had this difficult case where the patient had tics from Tourette syndrome and OCD, but the OCD was the main problem, that he was so obsessive with his hands and things like that. He was really losing his skin, and he was obsessive about many other things that was just driving everybody nuts. And to a point where we actually did an experimental deep brain stimulation surgery on that kid. I think he was by then 21 years of age or 23 years of age or something like that. So we did a DBS on that kid, and we did it experimentally, saying it's for tics, but his tics got better, which has been well documented that you can improve the tics by the DBS, but his OCD got better. And his OCD got better by the same target we use for tics, which was GPI. So we actually reported that case, it was published. But so the family, the Tourette family, can have a combination of some kids with the tics, that is the classic Tourette syndrome, but they can also be OCD and ADHD, and it could be same in the same kid. So it's possible that this kid, if he belongs to a Tourette family, meaning that other kids have tics in the family, or dad has tics, or someone else had tics, then it may be that he has both ADHD and tics.